During the outbreak of COVID-19, a total of 333 samples were tested for COVID-19. Of this, 16, which represent 4.8% of the total tested positive. 15 of those who tested positive were placed in our isolation and treatment facilities, where they received medical and psychosocial support. One person was hospitalized and received intensive treatment. 3 patients were successfully treated and cleared of the coronavirus. For those who follow, that is case number 3, case number 5, and case number 6. They have since been discharged from our treatment facilities. We have not recorded a death as a result of COVID-19. I would like to pause here to thank the 16 individuals who tested positive for their cooperation with our treatment regimens. And I also like to thank the team of the health professionals who have been and who are still managing the COVID-19 cases with such dedication and commitment that goes beyond the call of duty. One of our strategies is to isolate those who may have been exposed to COVID-19 in order to limit the transmission. Persons who came from countries with high burden of COVID-19 have been quarantined. So far, the total of persons quarantined is 263. A total number of 109 persons, they have been discharged from the quarantines since they did not display any symptoms which is consistent with COVID-19. Our response activities are anchored on the National Health Emergency Management Committee that handles aspects of coordination, logistics, laboratory testing, surveillance, case management, point of entry, and community engagement. The critical element in our response is the exceptional leadership provided by His Excellency, the President, in support of the Right Honorable Prime Minister, the Deputy Prime Minister, and Minister of International Relations and Cooperation, who is here this morning, and also the entire Cabinet. We continue to expand our infrastructure in order to deal with increased number of patients. In this regard, the following facility has been or are being developed. A 4-bed isolation facility at the Hosea Kotako International Airport, a 20-bed mobile military hospital at Hosea Kotako International Airport, a conversion and remodeling of Robert Mugabe Clinic into a COVID-19 screening and treatment facility, conversion and remodeling of Windhoek Central Hospital casualty with negative air pressure into an ICU. The construction of a 12-bed prefab inpatient facility for moderately ill COVID-19 patients at the Windhoek Central Hospital. And finally, the construction of a 540-bed Rhino Garment Treatment Center in the Ochomite area. In addition, a 200-bed facility is being developed at Ongwediva Trade Fair Center to cater for the needs of the northern regions. It is also a joint project between the public and the private sectors. The private sector has made welcome initiative to complement government efforts in order to contain COVID-19 pandemic. The Rhino Government Treatment Center is being developed jointly with the private sector. We have received many pledges of support, both in financial terms and in kind. While on this point, the media is playing a crucial role in disseminating correct information to the public. While on this point, recently there was a clip circulating in the social media of a Minister of Health and Social Services ostensibly receiving COVID-19 vaccines from the Chinese ambassador. In fact, the photo was taken at the occasion when I received test kits and not vaccines from the ambassador. Most of the media houses witnessed that event. I want to stress the point that such framing are not helpful but counterproductive to our noble efforts. So far, we have done well in controlling the pandemic together with our development partners. I would like to urge all of us to have faith in our institutions, in our systems, and in our processes. My call to the public is to remain calm, to remain confident, and to comply with the measures which are put in place and to stay at home. This will expedite our return to normality. I thank you.
Thank you very much, Honorable Minister, for that update. We now move over to the Deputy Minister, Prime Minister of our nation, but also Minister of International Relations and Cooperation. DPM, there's a lot of information or curiosity around our Namibians abroad amidst this difficult time. Perhaps you could just give us all-rounded information about their welfare, especially those in China as well, and any other information you'd like the nation to know about what MIRCO is doing to ensure all Namibians are taken care of at our different embassies and countries around the world.
Thank you, moderator, and our Deputy Minister for Information Communication Technology. Aware of the time, can I stand on the protocol established? Yes, moderator. COVID-19 is real. It has put the whole world on its knee. And what is really required now is cooperation, understanding, and true solidarity at all levels, from the household, community, national, regional, and global, because it's the only way we'll be able to win over COVID-19. Yes, as a government, immediately the outbreak of the coronavirus, the welfare of our nationals abroad has become our priority, particularly our students and citizens who were in China, being the first place that was attacked by the virus. Namibians know by now that at the time the virus was announced, we were talking about 500 Namibian students in China. That time, Wuhan, which was locked down, we had 27 students. But as we are talking now, the number of Namibian students in China has reduced to 357. That's because during that time, some of them has made their individual arrangements and they came back home. However, as a government, and particularly our ambassador in China, has been following the situation closely. And we have to know that in China, we have 3 categories of students, just like in any other country where we have students. And that is in terms of funding. The first category is students who are funded by the government of the Republic of Namibia. The second category are those who are funded by the Chinese government or any institution designated. And the third category are those students who are funding themselves. And during the time of the coronavirus, we were not informed of any sponsor that has been withdrawn. Not a single student has informed us that their sponsor has withdrawn their sponsorship. However, our ambassador is a person on the ground. Early in March, approached the government saying that there is a need for the mission to have a contingent, and I want us to underline the contingent. And the ambassador was very specific, saying that a contingent of 20,000 US dollar. When that request was made, the government considered and then agreed that instead of sending money to China, we would ask the Ministry of Home Affairs to authorize the mission to use the money which has been collected through visa and make use of that for that 20,000 contingent that was asked. When that was authorized, the ambassador, then looking into the situation on the ground, decided to attend to the students in Wuhan, whereby each one of them was given 220 Namibian dollars, which means in total, from the 20,000 US dollar, 5,940 has been used. And currently in that contingent, there's an amount of 14,060,000. And it's a contingent. We have to understand what is a contingent. I'm explaining this because there's been allegations that the ambassador is refusing to give student money which was sent to them. Yes, there was an announcement that each student in Beijing, in China, could be given 180. But that was a big, big mistake, which we have explained. Because if you take the 20,000 US dollar, and then you can divide it with all the students in China, giving 180 each, including the 220 given to the 27 in Wuhan, that cannot be enough. So that is what we say, we should remain with the initial intention of the money, which should be a contingent. And a contingent is an amount that you keep in order to handle with emergencies. So up to now, we don't know how this coronavirus is going to move. And that is why that contingent will remain there to deal with critical situations as they are coming up. I really thought I can explain to that. And then now we come to generally to take care of the welfare of Namibians abroad. Yes, the whole world now is locked down. What we have done, we have directed our nationals through our social media that whoever is stranded, they should go to our missions. And then our missions will look into cases as they arise. But you must also appreciate that the transports all over the world is now on a standstill. And that's why we are so encouraging our nationals to remain where they are. And this is also an advice from the World Health Organization, because the fear is you may be not having the virus, but then you can contract it through your movement. And that is why even when our students in China, specifically those who were in Wuhan, when there was an issue whether we repatriate them or not, we said as a government, we advise them to remain because they will be safer instead of them to be moving. And that remains the position, particularly as we all can see now, the whole world is now affected. And isolating yourself and keep a distance is the way to go. And that is really the position in as far as taking care of our nationals who are outside the country.
Thank you very much, DPM. Before I give over the media to ask questions, just to clarify, you said of the 20,000 contingent, for the students who are in Wuhan, they got 220 US dollars or Namibian dollars? US dollars.
Yes.
Okay, just for clarity to ensure that. All right. Are there any questions from the floor, from the media practitioners here with us in the center this morning?
My question goes to the DPM. I just wanted to get clarity. I think international news has since announced that there's an additional package that's coming from the Jack Ma Foundation, the one that includes about 500 ventilators for all African countries. Have we benefited from this, or have we had any communication from the Chinese so far? Thank you.
Thank you very much. Yes, DPM. Yes, he's asking around the additional consignment from the Jack Ma Foundation, if it has arrived, or what is the information around that one?
Yes, it's correct that there is additional donation that is coming from the Jack Ma and the Alibaba Foundation for the whole of Africa. We are expecting that donation to arrive in Addis Ababa on the 13th April. So the Namibian government is making arrangements to bring our consignment home. I might also inform you that we are also expecting a donation to come from the government of China. And it's also arriving in Addis Ababa, more or less at the same time. So the arrangements we are making now is that we just make one trip to collect all the consignment. So currently consultations are taking place. Immediately the goods have arrived, and the consultation is between the Ministry of Health, the Ministry of State-owned Enterprise, with particular reference to Air Namibia, and the Ministry of International Relations and Cooperation, in order to make sure that immediately those goods arrive, we'll be able to pick them up.
Thank you, DPM. Yes, sir.
Very good morning to you, Honourable Deputy Minister, Honourable Deputy Prime Minister, and the Minister of Health and Social Services. Just a follow-up question relating to what you shared with us, Honourable Deputy Prime Minister, relating to the students in Wuhan. We understand those who had to vacate the hostels where they were staying had to go live in hotels, which they in the meantime also had to leave. Do you have any more information about that? Also, with your intervention, we've been able to get access to supplies of medical goods and services from South Africa, but we understand there are challenges within the country, particularly where we have roadblocks in and around the locked down areas. And then finally, we saw a report last night that the presidential spokesperson, Dr. Alfredo Hengari, had confirmed that the police officer attached to State House has been placed in self-isolation, seeing that his spouse is one of the confirmed COVID-19 cases in Namibia. Can you please elaborate on that and share to what extent journalists and ministers and other employees of State House may have been exposed to? Thank you very much.
Thank you. DPM.
Thank you very much. In relation to our students in Wuhan, when it comes to their accommodation, there is no accommodation program at all. Even this morning, I was talking to the ambassador, and we don't have an issue with our students in Wuhan. If there is any, it has not been brought to our attention. However, I'm aware of a video circulating of a lady who claims to people being forced out of the accommodation. When we follow up on that particular case, we realized that this is a business lady who arrived in China on the 5th of March, and they were living in a hotel. But then they were asked, all the occupants in that hotel were asked to evacuate the hotel and then placed in another hotel. And I even listened to her audio talking in a discussion, confirming that where they have been put, they were put by the same hotel where all the people who were residing in that hotel were placed. On the issue of South Africa, I have also seen social media circulating that Namibia was having a problem to import medical supply from South Africa, and the Minister of International Relations intervened, and now such a medical supply is coming. That's not correct. At no point the Ministry of Health has conducted us having programs for the importation of our medical supply. I even asked our Minister of Trade to tell us whether they have any program of importing the supply which is required for us to produce the material required during this period. And she informed me they don't have that program. So the government has not faced any importation program between South Africa and ourselves. So there's nothing like that. And then the other question, which though it has a social nature, it has also a medical dimension. Because when it comes to healthy, how to handle information, it has to be handled from the medical point of view. When you are asking whether the State House, those of us who are frequenting the State House might have exposure, maybe if I can ask the Minister of Health to assist on that question, since it is a dimension of health in how you can deal with communication which is health related. Comment, Minister.
Thank you very much, Comrade Deputy Prime Minister and Minister of International Relations and Cooperation. I have shared with you earlier the result of a health worker who is a contact of case number 3, which happened during the performance of her duty as a health worker. The concerned health worker stated positive to coronavirus and was managed according to the protocol. She's a spouse of somebody who works at State House. The whole household was subjected to testing, and all of them tested negative. So there is no question that any of the persons or individuals who are at State House or who have visited State House are at any risk of exposure. So that's the answer to the question. The challenges with regard to equipment for COVID-19 is a worldwide phenomenon. Number one, as we know that COVID-19 is pandemic, which means that most countries of the world have been affected. And there is a need for equipment all over the world. The supply is strained because of that fact, and an additional factor is the fact that the normal route of delivery of goods and services has been curtailed because most of the airlines have been grounded and most of the modes of transport have been constrained. But I would like to give you the assurance that at the present moment, whatever we need to cater for our COVID-19 patients, we are able to deliver that service.
Thank you, Honorable Minister. There was a question here.
Good morning, everybody. Good morning to the panelists, honorable ministers and deputy minister. Good morning to everybody watching at home. This is most probably the far-stretched question. Honorable Minister, is there any chance that, maybe as time goes, we will have the opportunity to hear from those that have recovered as to how they have dealt with the virus? Should there be perhaps, a few tips that have been, going through just to make sure that they, just whatever actually they have been doing just to, to keep themselves, really fighting the virus? Because a wise man once said, the best way to defeat something is to learn from those who have done it before, or those who have been there before. Thank you so much.
Thank you. Ma'am, the floor is yours.
I have a few questions, actually. I wanted to find out, after the lockdown is over, what is our exit strategy? And how do we get out of this lockdown without risking any outbreaks when we do? And then I wanted to find out, I know this question has been asked a lot of times, but what is our testing capacity? Like how many people do we test in a day? And also the question of ventilators. I want to find out how many ventilators do we have currently? And lastly, I wanted to find out the number of calls registered on the toll-free number a day. How many are they? Thank you.
Thank you very much. I think if not all, perhaps DPM would like to come in the middle where she can. Dr. Shangula, the question of recovered, are we going to hear from those that have recovered? And exit strategy from the lockdown, testing capacity and the number of ventilators and the number of calls the emergency line gets on a daily basis.
The first question related to whether it's possible to hear from those who have recovered from coronavirus. Those who have recovered, as I mentioned to you, case number 3, number 5, and number 6, they have been cleared of the virus. They have been discharged from our facilities, and they have gone back to their homes. If anyone would like to contact them, they are free individuals, just like any one of us. So it will really depend on the individual whether he or she would like to share the experience, because they are free citizens just like you and me. So there is no prohibition except that there should be a consent between you and the individual concerned. We can give you Their contact details, these are available, and at your own pace, you can contact them.
On the exit strategy, it says both economic and social sector. Because as you have noted now, the whole country, just like any other country in the world, is like has closed down. The economy is no longer functioning as it should function. The society is no longer living the manner they used to live. Definitely, as a government now, we have the committees, particularly we have the Economic Committee that is drawing strategies on exit from the lockdown from the economic point of view is how do we start our economy to function. You have also the social sector that are working on the exit strategy at the social level. For example, our education sector. What is going to happen depends now how long we are going to be on the lockdown. And then you have now the welfare sector. You realize that currently we are taking care of people from different sectors of our society. The media, you have been helpful in communicating to the nation what is happening. For example, here in Windhoek, we have the homeless that we are hosting at different places. After the lockdown, are we going to allow them back to go under bridges? So we are working on strategies on how we are going to deal with these situations. So these are all the sectors as we are involved in how we can go through the coronavirus. We are planning and strategize on our exit from the lockdown. So there are all the ideas and plans that are going on. And that's why we keep saying we are asking the whole nation individually and collectively to cooperate during this period and after, so that we can move together in order to revive our life again, which is badly affected by the coronavirus.
As far as the public health sector is concerned, as currently we maintain a certain level of health care. To sustain that type of level of health care, you need resources, especially financial resources. As you know that during the lockdown, the economy has been suppressed. It will be at a lower level after the lockdown. So the challenge which we may face will be simply related to financial resources. But at the present moment, I would not foresee that will have a major effect in our operation as a public health sector. Second question related to the testing capability. I think you'll hear about more when the NIP will be here to talk about their operations. But what I can tell you is that currently we have a capacity to test with one run of about 96 tests. But so far, the experience has been that the operation, it has been operating at 30%, which means there is excess capacity of about 70%. And this is simply because the number of specimens which are sent for testing does not reach the maximum capacity of the of the single run. But we have enough capacity to do so. And then the NIP intended to expand that capacity so that not only tests will be done in Windhoek, but it will be decentralized to different centers like Oshakati, Rundu, Walvis Bay, etc. So the capacity, currently we have enough capacity to test as the need dictates. Next question relates to the ventilators, the favorite subject, the ventilators. Currently, before COVID even, we had 39 ventilators in our public health facilities. We have purchased additional 10, which are currently not being used yet. We intend to install some of them in the newly constructed facilities. There is a number of 10 which are on the way coming, and which we have already been accessed, procured, on the way coming. And then we have again ordered another 83 ventilators. So that is the whole number of ventilators which we have. But I just want to explain that a ventilator is simply a machine when the lungs of an individual is compromised to an extent that a person is not able to breathe sufficiently on his or her own. And then that machine will assist, will breathe for the person. That is the extreme end of the patient who is in a very critical condition when the lungs become compromised. It is not really something which you use on a day-to-day basis. But as I have said, we have this one already in our health facility. I mentioned to you the number of 39, which have been with us all the time. And we are now supplementing those in case the number of patients who would need to be put on ventilator, on a ventilator increases. It is not a treatment per se. Our aim is really to ensure that, to make sure that our patients do not reach that stage. So far, even the critical patient which we had, case number 3, did not require the use of a ventilator. Then the last one is the number of calls. Unfortunately, I am not able to get that number now. I don't have that number now. Had I known that you will ask that question, I would have asked the call center to provide me with the information. But it is available. You can get it later on. Thank you.
Thank you, Honorable Minister. Yes.
On the issue of the ventilators,
Yes.
the consignment we are expecting from Jackman and the Alibaba Foundation, they have informed us that among the goods that are there are 10 ventilators.
We have a last chance for questions. I promised already, so I cannot track back. Ma'am, the floor is yours. Maximum 2, as well as you, sir.
This one is for the Honorable Deputy Prime Minister. How many Namibians are stuck in other countries as a result of the COVID-19? Has the International Relations Minister received any requests by any Namibians seeking repatriation? I'll ask my other questions afterwards. Thank you.
Thank you very much. And lastly, sir, the floor is yours.
A number of U.S. senators have called on the head of the WHO to resign, arguing that the WHO was complicit in allegedly helping China deceive the world about the extent of the COVID outbreak during its early stages. We know that the African Union has come out of a statement in support of the head of the WHO, appreciating his efforts and so on. What is the official stance of the Namibian government and the ministry with regard to how the WHO handled the outbreak at its early stages, and your thoughts on calls for having the head of the WHO calls for him to resign? And then Secondly, to the Health Minister, the Agriculture Minister, Mr. Kale Shetterwijn, recently tweeted that the decision by the EU, India and others, and now South Africa, to ban exports of essential medicine is very worrying, and that such an approach lacks human compassion and solidarity. Has the Namibian government experienced any challenges in importing medicine from countries such as India, the EU and South Africa? And if there is a growing ban globally when it comes to the exporting of medicine and other essential goods, and what measures are put in place to mitigate the harms that might arise because of that? Thank you.
Thank you.
I've got one question for the Deputy Prime Minister. As things stand, the official lockdown period lapses on the 17th of April. Will it be extended? When will that be? And until when will it be extended? And then a quick question for the Minister of Health. If a patient is tested during the incubation period, will he or she test negative or positive? Please elaborate on that. Thank you very much.
Thank you very much. The first question is the number of Namibians who are stuck and those who want to come back. At this stage, we cannot really give you the exact number, but of this morning, we were given the number of 15,000 Namibians who have recorded themselves with our missions abroad, but not all of them are saying they want to come back. However, there are those who indicated want to come back. They are in Guinea, Singapore, Mali, Cuba, and Canada. However, we have asked them to give more further details because, as I mentioned earlier, the challenge we are facing is that there are no planes. And you might find in one country, you have 2 or 3 Namibians who are in that country. And it will be very difficult how we can make arrangements for them to travel. The only thing we are doing now, when they are in contact with our missions, is to give them some psychological support and to see how that can sustain them. And then on the issue of the World Health Organization, our position on that matter is very clear. And we were just in the process to issue that statement. It's very short, and I can read it to you now. We are saying that the government of the Republic of Namibia has noted with concern several voices raising in unfounded and disprogramming criticism of the Director General of the World Health Organization. In condemning this criticism, the government of the Republic of Namibia wished to voice its support for Dr. Tedros and encourage with gratitude the notable achievement and remarkable leadership he has shown in the health sector since he assumed this position in 2017, particularly in the area of health emergency. The government of the Republic of Namibia wishes to call on stakeholders to adopt a spirit of solidarity in these trying times, as well as we battle with the same enemy, the COVID-19 pandemic. So that is our position as a country. We support Dr. Tedros. He is doing a commendable job in this very difficult time. And this is not the time of blaming, it's the time of finding solutions if we are really having to win over the COVID-19. Other question as to the date approaching of the 16. Yes, the 16 has been set based on the health advice that we are getting. Today is the 9th. We still have 7 days to the 16th. And I have to tell you, Ministerial Committee which is chaired by the Prime Minister. In fact, is a extended cabinet committee on defense, security, and international relations, which now has all the ministers participating, is meeting regularly. And then depends on the health report, we continue to assess the situation. I might also inform you that tomorrow the cabinet will be meeting on COVID-19 and also to determine and to make assessment on what we have achieved in the past weeks when we have been now implementing the restriction which is part of the state of emergency and the lockdown of the two regions. So based on that assessment, we'll be able to tell whether we are going to get out of this restriction on the 16th as planned, or any other strategies have to be developed. The only thing we can assure you as a Namibian nation, we will inform you in advance so that there will be no surprises, so that we all prepare ourselves. It's a very difficult situation in which we find ourselves, unpredictable, and that's why we keep saying we are appealing for the understanding of each and every citizen of our country and everyone who's living within the Namibian borders.
Thank you very much, DPM. Honorable Minister.
Yes, maybe just to first let me add to what the Honorable Deputy Prime Minister has mentioned on the issue of the lockdown. From the public health point of view, there is a measure which we call an indicator, which we consider when it comes to infectious disease. That we look at the basic reproduction ratio, which is really a measure to indicate if you have one case, how many cases are being generated by that particular index case. In other words, if you have got one person, what is the likelihood of that person, of how many the numbers to be propagated in that respect. Now there is that measure indicate when it is above 1, it means that the propagation is still continuing. It means the outbreak is still continuing. You would want to reach a stage where one case would not give rise to another case, which will then mean that you are about to defeat the outbreak. So those are the indicators we look from the public point of view to determine the course of action. The point related to the banning of export of medicines and other pharmaceuticals from South Africa, as has been already mentioned by the Deputy Prime Minister, that we do not have a problem with sourcing of medicine and other pharmaceuticals. What the challenge is really the availability of what we need, and also the mode of transporting those commodities from where they are to where they are needed because of the current situation. Now, the incubation period, when an individual is exposed to COVID-19, say that the date of the exposure is day 1, it will take about not less than 2 days before the current method which are being used to detect the presence of the virus in the individual can be detected. Now, between day 0 and day 2 or 3 or 4 or 5, when the conversion takes place, that we can call it the incubation period. Now, is that period effective or not effective? These are some of the questions which are still being debated. This is a new disease. It has never been there before, and a lot of it is still unknown. And therefore, it's simply safe to say that within a period between 2 to 14 days, if the virus is present in an individual, the symptoms are likely to come out that the person has got COVID-19. And if a test is made between those days, if the virus is present, then the test will be positive.
The issue of the Director General, I can inform you that even our President has tutored in support of the statement made also by the AU Commission Chairperson, and he was joined in this by President Kagame as well as President Cyril Ramaphosa, all in support of the Director General of the good work he is doing since he assumed the responsibility, particularly this during time of the COVID crisis.
Thank you very much, DPM. Perhaps we could do final words. We can start with you, Honorable Minister, so we can end with DPM.
Yes, my final words, I would like to thank the public for the amount of understanding and also for cooperation in our efforts. And I would like to also thank everybody who is really ready to make contribution, positive contribution to the fight of COVID-19. And I would like again to stress that the more we cooperate together, the more we can defeat COVID-19 and the more we can return back to normality. Thank you.
Thank you very much. Starting as a Minister of International Relations and Cooperation, I want to emphasize the point that it's our responsibility to ensure the welfare of our people abroad. And we are asking them to cooperate with us and to be in touch with our missions abroad. In the audience, I have officials, and I want them to distribute the list of the conduct of our missions, the emergency numbers. They are listed there, so that we can publish it as widely as possible in our own social medias, so that our citizens, they know whom to contact when they are outside. Then now talking as a Deputy Prime Minister on the office of the Prime Minister is to thank all of you for the support that you are giving to the management of the COVID-19. Those who are doing it in kind and those who are doing it in cash and those who are providing the services. We are talking about our nurses, our doctors, our social workers, our people in uniform. You are doing a commendable job. It's not an easy time. It's not an easy time, we emphasize. And we really want the cooperation of each and everyone, because there will be no winner, there will be no loser. We are going to win together, we are going to lose together. And let us help our people, particularly those in informal settlement, those who have lost their income because the business they were doing have closed it down. They are now in our hands to share the little we have, and then while maintaining all the protocols that are put down. Thank you very much.
Thank you very much, DPM and Minister of Mirko. That is all the time we had today, viewers and listeners at home. Secondly, we have materials that we have published with the support of partners. We thank them for that have been translated into our local languages and are available outside for the media to inspect and to share that knowledge of that material. And lastly, I would like to thank our panelists and all of you that continue to assist us to ensure that we make this communication center one one that is able to ensure every Namibian is informed about the information out there around COVID-19 in Namibia. That's all the time we had. Thank you for staying with us.